Cedar, pine, and elm. It is the triple threat aggravating your allergies these days. KLTV7's April Peardon has more on the steps you can take as the pollen levels pick up.
We're just now starting to see allergies pick up.
Pediatrician Dr. Blanco is busy seeing more allergy-related visits at CHRISTUS Mother Frances Lindale Clinic.
In springtime, tree pollen tends to be the primary allergen in the air. In East Texas, we have the cedar, the pine, and the elm trees that produce pollen that tend to aggravate our allergies.
Typical symptoms include a runny nose, sneezing, and itchy, watery eyes. Dr. Blanco says you can prevent exposure and reduce these symptoms by
keeping your windows closed, using the AC unit with a HEPA filter. If you're going to be outside, taking a shower once you come inside. And if you tend to have those eye symptoms, even wearing sunglasses can try to help reduce some of that pollen getting into your eyes, causing the irritation.
If symptoms persist, prescription or non-prescription nasal steroids like Flonase or Nasonex may be added.
And then there's even newer products that actually have a nasal antihistamine in them called Astelin that we're using as well.
In some cases where individuals with severe or difficult to control symptoms come into play, she recommends for people to ask about allergy shots.
Once we know what your triggering factors are, then they can make solutions.
But that can take time and trial and error.
Typically, you'll be getting allergy shots for 4 or 5 years to really desensitize you to everything.
Allergy season is here, and Dr. Blanco says the sooner you start managing your symptoms, the better your spring will be. April Peardon, KLTV7 News.
Now, if symptoms are severe, persistent, or not relieved by over-the-counter medication, it is suggested that you visit with your doctor.